Hi, my name is Ernesto Jaime Jr. I'm from the Universal Skills Development Institute, and today I'm going to perform the activities of daily living, which includes the elimination of urine, the hair care with shampooing, shaving, oral care, and then we're going to proceed to the complete bed bath with the hand care, foot care, perineal care, and then we're going also to have the complete change of the bed linen or the bed making, and then we're going to have the changing of the clothes or the dressing and the undressing procedures. So now I will proceed for performing the ADL. Good morning. How are you, sir? I am June. I will be your caregiver for today. And how are you? Okay, sir. Can I ask your name, please? Mr. Abdullah. Abdullah, what is your family name? Abdullah Muhammad. Excuse me, sir. I just have to check your name tag here. Okay. Yeah. Sir, Mr. Abdullah. We're going to do some activities this morning. We're going to have your hair care, shampooing. We're going to shampoo your hair, and then we're going to have some shaving, okay, and then some toothbrushing, or we have to have the oral care. Okay, and then after that, we are going to have the complete bath. So I'm going to give you some bathing. Okay, is that okay with you? Okay, sir, thank you. But before I'm going to do that, I'm going to check your vital signs, which is that I'm going to take your blood pressure, okay, and also your temperature and your pulse rate. Okay, would that be fine with you? Okay, sir, thank you. So let me just prepare all materials, and I'm going to proceed with our activity. Okay, now this time, I'm going to have the safety, and of course, I have to maintain respect. Okay, so first is I have to close to make sure that the privacy is maintained. So I have to close. If there is a curtain, then I have to use the curtain. Close the curtain and check for the safety. The wheels. Okay, now I have to check also if there are some machines connected to the patient. I have to check if all are functioning. Now, I have checked and all are working well. I have already provided the respect or the privacy to the patient. So I may now proceed to the next step or the next procedure. So this time, I'm going to start my activity by getting or taking the vital signs of the patient. Now, why it is very important? Because before I'm going to move the patient, I have to make sure that the patient is stable. So through taking the vital signs, I will be able to know if the patient is stable. Okay. So now, sir, I'm going to take your vital signs. Okay, so first, I have to show my patient that I am maintaining hygiene. So I have to show him that I have cleaned all the materials well. So I just have to clean up everything so we can use it. Sir, is it okay with you? If you can you help out yourself? Can you put this one, or do you want me to put it? Now, if the patient is able, let the patient put the thermometer into his axilla, okay, to the underarm. So if he is not able, then you have to make sure that this is done properly, okay. So I just have to raise this one. If my patient is not able, then I have to check this, and then put this, and leave it for a while until it beeps. Okay. Then, I have to prepare everything. Now, the thermometer is already beeping. I have to take, okay, the temperature is 36.5, which is normal. And I have to clean it again. And put it back in the container. Now, I have to check his pulse rate. Sir, I'm just going to take your pulse rate. I'm done with the pulse rate. Okay, the pulse rate is 80. It's normal. And I have to record. And then, sir, can I just have, again, for another minute? Now I'm taking the respiratory rate, but not telling him that I'm taking the respiratory rate. Okay, rise and fall. Respiratory rate, we have 18 breaths per minute. It's normal, record. And then, I have to take the blood pressure. I have to make sure that the patient sees, show to the patient that I am maintaining hygiene, so I have to clean. Okay, so I have to show him that I'm maintaining hygiene. So, sir, I just have to clean all the instruments. Okay, so I have to clean it properly. Okay, so now this is clean. So you have now to take the blood pressure, sir. Excuse me, just have to take your blood pressure. Okay, so I have to roll, and then take the blood pressure. Okay, now I'm done with the blood pressure. Okay, blood pressure, sir. Your blood pressure is actually 120/80, so it's just good. Okay. So now I'm done taking the vital signs. Okay. Sir, do you feel any pain right now? Okay, so there's no pain. Sir, is there any pain? Okay. Which part, sir, that you feel pain? Now this time, the patient feeling some pain in his body. Okay, sir. So where is that pain? Can you please tell me? Stomach. Is it right here? Right here. Okay. Okay, sir. Now, from 0 to 10, 0, no pain. 10 is the severe, painful. Okay. Can you please tell me from 0 to 10? Okay, so it's 6. Okay, 6. Now, sir, I'm just going to tell my nurse, okay, the nurse in charge, to give you maybe some medicine to relieve you from the pain. Okay, but for now, okay. Now, if the patient has no pain, then there's no problem. Then I have to proceed with the next. I have to maintain safety. Always raise the with your shampooing. I just have to ask you, would you like to urinate? Okay, sir. So, if the patient would say that he doesn't want to have to take the urination or to urinate, then you can proceed. But always remember that the patient, when he gets wet, there's a possibility that he will actually urinate. So this time, before I'm going to proceed for the hair care and shampooing, because he will be exposed to the water, then I have to eliminate the urine first. Now, I will be doing the urine elimination. Okay, so now I'm done wearing my gloves and I'm prepared to take to have to do the urine elimination. Since the patient is having a catheter, so I still have to take the volume of the fluid, okay, the urine. So here, I have to read. So this one is, okay, this is in milliliters. So I have to read this one. 500, 1000, 1500, 2000. On the other side, we have 500, the same. So now I'm going to so the volume is around 100, so it's around 200. So 100, 200, 300, 400, 500. So I have to note that this is actually around 110 or 120. Okay, so now I have to eliminate the urine. I can use the urinal. I don't have to remove this one, but just to loosen this so that the urine will come out. Okay, now I have already eliminated the urine. Throwing this to the bowl, okay, and then put it aside. Now, what if the patient is not cathetered? After I'm going to eliminate the urine, I have to remove my gloves and throw it in the... So now, I have to do the hand hygiene. My patient has to catheter. So I have to do another strategy of urine elimination for a patient with no catheter. And my patient is male. So now my patient is male and no catheter. So the materials that I would like to prepare for the elimination of urine for a patient with no catheter, if he is male, then I have to use the urinal. And then I have also to prepare some tissue. Okay. I have to prepare some tissue, the urinal, and bed protector. Okay. So now I'm ready. Sir, I would just like to take some time for you to urinate, okay, before we go to your shampooing, okay? So, excuse me, but I have to move this downward. And this is actually, you have to do it fan folding. Okay, leaving the gown only. Unfolding the top sheet and also the blanket, and just leave the patient's gown. Sir, is it okay with you? Can you do it yourself, or you want me to do it for you? Okay, the patient is not able, so I have to do it myself. Now, it is very important that I have to make sure that the elevation of the head is enough for him to be able to urinate. So I have to make some adjustments. Sir, I have to raise a little bit your head, okay, before I proceed. Is that okay with you, sir? How about that? Okay. So now I can proceed. So, sir, I have to put this. Okay. So I have to make sure that I maintain privacy. Okay. Now the patient has no catheter this time. Since he has no catheter, then I have to place this on his penis. Okay. And for privacy, sir, I'll get back to you. Okay. Or once you're done, I just stay here. Okay. You can urinate and then just tell me if you're done. Okay. So I have to make sure that he has the privacy. 3 to 5 minutes. I presume that he's done. Sir, is it okay now? Are you done? Then I can ask the patient, sir, would you like to wipe? Okay. However, always remember that because you have already used your gloves, then you have to remove your gloves again before going again to your patient. Going to the 5 moments after touching the patient, especially when urinating, you have to replace this one and have another one. To wipe your can you help it yourself to wipe yourself to wipe your penis? Okay. Can you do it for yourself, sir? Okay, so I'll do it for you. So I have to remove this. And clean. Make sure that there is no spillage. Okay? You just have to wipe here. Okay? And then okay. Then you have to throw this. Excuse me, sir, I have to throw this one. Huh? If the patient is female, okay. Now this is a procedure for the patient for a female patient. You have to make use of the bedpan. Of course, again, you have to wear your gloves, hand hygiene, tissue paper, and bed protector. So now I have to do the, ma'am, excuse me, I just have to put some bed protector. Now I have to let her turn to the other side, okay, so that I will be able to put the bed protector. But if there is already a bed protector, okay, you are not anymore going to put your another bed protector. But if there is no bed protector, then you have to put the bed protector. Okay. Now I see that there is a bed protector already. So I have to maintain. Now, is it the possibility there is if the patient has an IV here on this side, then you cannot turn your patient to that side. So you have to change your position to the other side. Okay, I cannot use that side because there is an IV insertion. So I have to use this side. Okay, now I have to put the bedpan. I have to make sure, okay, you can also use some powder from the bedpan to avoid, for easy insertion also. Okay, so I have to insert this. Okay, ma'am, I have to turn you around here. Okay, now I have to make sure that the bedpan is placed properly. Okay, pause. Okay, so this time the patient is female. Okay, so just for a demo purpose, I have to show that the patient is female. Okay, so now I have to make sure that the bedpan is inserted properly to avoid spills of urine. Okay, so now I have to ask my patient, okay, ma'am, okay, is it okay with you? I just have to stay away from you so you have your privacy. So I have to maintain privacy. I will give her 3 to 5 minutes of privacy and take the urine to do the urinating process. Now 3 to 5 minutes is done. I have to go back and change again my always remember that before and after touching the patient, you have to do the hand hygiene. The gloves, always make sure that. So now I have already changed my gloves. So I have to offer again. Okay. Is it okay with you if you can wipe your genital? Okay. So I have to do it. Once she cannot do it, then I have to do it myself. I have to check if there are some spills on the side. If none, then I just have to wipe the center going down. Okay, but if there are some spills on the side, then I have to make sure that it's clean. So I have to do the perineal care. Okay. Okay. So now, ma'am, it's done. I have to make sure okay, it's done. Then I have to make sure, okay, ma'am, I have to remove this. You're the bedpan. You can just, for a count of 1, 2, 3. 1, 2, 3. Okay. So now I have already done the elimination of urine for the female patient. Okay. Then, if I will be asked, if there is an order from the doctor to take a sample of the urine, what will I do? I cannot take the sample of the urine, okay, unless if it is cathetered. Then I can take the sample from the catheter from the urine bag. But if there is and there is nothing, then I have to take it directly from the genital. Okay. The first is that to consider is that if you have to take the sample of the urine at the middle stream. Okay, middle stream, which means that the first stream is rejected, then you have to take the sample at the middle stream. Okay, so then I have to do some recording to take note if there are some. Okay, if you see that there is some blood in the urine, then I have to take note of that. If there are some abnormalities in the genitalia, then I have to take note of that. That is part of the observation, reporting, and documentation. Okay. When I'm going to take also the urine elimination, I have to do the inspection of the integumentary system, the skin. If there are some lesions or there are some signs of allergies, then you have to report that one also. Okay? Now I'm done with the elimination of urine. Okay, now Now I am done with the elimination of urine. I can proceed now to the hair care and shampooing of the patient. Now, what are the materials that I need for the shampooing and the hair care? Of course, I need some, we call this a shampoo throw. Okay, this is a shampoo throw. I need the shampoo. Okay, I need a shampoo. I need a pitcher, and I need also some deodorant. Maybe my patient would like to have some deodorant. And I have to prepare also face towel and 2 bath towels. Okay. So this time, I have to make sure that the patient has already done his urination, okay, done urinating, to make sure that he will not urinate or she will not urinate during the shampooing. Okay, now, I have to prepare. Mom, we're going to proceed to your hair care and shampooing, okay? So I just have to prepare you. Now, this time I can remove the headboard for the patient to be able to, to avoid some blockage. Okay. Now, I have to make sure that the patient is lying nearest to the edge of the bed. So I have to put him or her in a supine position. And if the patient is away from the edge, then I have to make sure that I will be able to pull him out. So I have to use again my force. Sir, I have to pull you outward so we will be able to have your shampooing and hair care, okay? So at the count of 3, if the patient is enough for you to be able to move him upward, it's no problem. But if if the patient is heavy, then you have to ask help. Okay, now the patient is just normal. I mean, the weight is a little bit lighter, so I can pull him up. Sir, I have to pull you up. Okay, can you please, if he can help to move to push with his feet, then you can ask him, sir, can you please push your feet as I'm going to pull you up? Okay, so 1, at the count of 3, 1, 2, 3. Okay. So now, he has nearest to the edge. Another 1, 1, 2, and 3. Okay. So now the patient is near to the edge. Then I have to remove the pillow. Okay. Make sure that all the materials are located near to your site of performing the activity. Okay? So now I have to roll this. Sir, I have to remove your pillow. Make sure that you are going to protect the patient's head and neck while removing the pillow. Change it with the... Sir, I have to put this on your neck. Okay. put the shampoo through. Put the okay. How do you feel, sir? How do you feel? Okay, so now I can proceed with the shampooing and hair care. Before I'm going to proceed with the hair care, with the shampooing, I have to check, palpate the head, check the hair if there are some lice. Okay. Also the ears. Check if there are some abnormalities. If there are, then you have to record it. Okay, sir, we can proceed now. Okay, so now I have to make sure that I have some water. And prepare also. Now, my patient is prepared for the shampooing. I'm done checking the hair and the head, palpating, inspectioning. Okay, now I have to put a small towel to cover the eyes. Sir, I have to cover your eyes, okay? Yes, sir. Now, I can proceed with the bathing. So I have to pour some water, slowly by slowly. Massage a little bit and put some shampoo. You have to massage the head and the hair thoroughly but with care, and always talk to the patient. How do you feel now, sir? Do you feel relaxed? If he is able to communicate, keep on communicating, let him talk while you are doing the shampooing. Now this is actually part of the holistic approach or the holistic and therapeutic approach to the patient. Communication is very important. So sir, how do you feel now? Okay, now we're going to rinse your hair. So you have to rinse. Make sure that the water will not reach the outside of the head or in the forehead. Okay, to avoid spills on the forehead, you have to protect. Okay. Now I am done. Sir, you have to remove this. And put your so you have the blanket here, the towel, and dry the patient's hair. So how do you feel now, sir? Okay. Okay, you see, feel good. Okay, I have to remove down this one. Okay, and then pause. Okay, and I have to comb the hair to make you feel better. Okay, just slowly for the grooming. Okay. So sir, now we're done. I have to remove this. Okay, and put this away, and then you can actually put now the pillow again. Sir, I have to put back your pillow. Okay. And I have to return this. Now I'm done shampooing and the hair care. So I can now proceed to the next procedure, which is the shaving and the oral care. Okay. Okay, now I'm going to proceed to the shaving. Okay. Sir, we're going to have some shaving, okay? Now, okay, record. Okay. So now we're going to proceed with the shaving. Which one comes first? Is it the oral care or the shaving? Now, this will depend on the situation. Now, when you say the patient is male and have some mustache, then you can ask the patient, sir, would you like me to shave your mustache to clean up your face, to make you feel good? Okay. Now, actually, that is for the reason for that is hygiene. It is easier to maintain hygiene if the person has no mustache, especially in the hospital. So to maintain hygiene, I can convince him, sir, you will feel good and you will look good if your face is clean. So would you allow me to shave your face? Okay, so yes. Now, then I have to do first the shaving before the oral care, because that is to avoid the second time that you're going to do the oral care. Why? Because once you're going to do the shaving, there is a possibility that some hairs will go to his mouth. So to avoid the second or the repetitive process, then you have to start with the shaving. But if your patient is female, no mustache, then you can clean later on the face, but you can proceed to oral care. Shaving is only good for male with mustache. Okay, so now my patient is male with mustache. So I have to provide him the shaving or the facial care. Okay, so now, sir, would you like me to shave your mustache so that you will feel good and you will look good? Okay, sir. So thank you. Then I have to proceed now with the shaving procedure. So what do I need for the shaving procedure? The shaving procedure, I need some shaving cream. Of course, I need to have some shaver. It is very important to note that if your patient is diabetic, do not use the one with the blade. Use the electric razor. Do not use the blade shaver. Okay? So that is if your patient has diabetes. To avoid injury or some bleeding, and later on it will actually create more problem. And I need also some kidney basin, and I need also some face towel. Okay. Now I have to bring this. The head is elevated, okay, based on the requirement. Okay. Since my patient, okay, I need to know if it's okay with him. If it allows me to elevate his head, it depends on the situation again. If the patient is allowed to have some elevations, you have to make sure that your patient is still comfortable with the elevation. But if the patient has what we call some surgery on the abdomen, then you cannot have it more elevated. So this time the patient has no surgery. So I can ask him, sir, I have to elevate a little bit your head. Can you please tell me if it's okay with you? Okay, sir. Is that okay with you? How about that? Can I still have it more? How about that? Your target is for you to be able to have the shaving, effective shaving. Then it is much better if you can have it on a fowler, not on a semi-fowler. So the fowler is at 45 degrees to 60 degrees. Okay, so now I'm having the fowler. Now it will be easier for me to do the shaving because it's already elevated with the convenience of or comfort of my patient. Always ask the patient, sir, is this okay with you now? I have reached my target, my goal, and it's okay with him, so I can now proceed. So now, sir, we're going to proceed with your shaving. Okay. Now, before I'm going to proceed to the shaving, I have to make sure that I have changed my gloves because I use my gloves during the shampooing, the hair care. So I cannot use this one anymore. So I have to change my glove. Hand drop again. Have it dry. And wear again the new gloves. Okay, so now we're going to proceed to the shaving procedure. Okay, so sir, we're going now to prepare you for the shaving. Okay, is it okay with you? Okay, so he approves. Now the materials that I need are shaving cream, shaver, I need also some face towel, kidney basin with water. Okay. Now take note again that if the patient has diabetes, do not use the blade shaver. You have to use the electronic shaver. Okay? Why? Because that is to avoid injury to the face of or the skin of the patient, which is not good for a person or patient with diabetes. Okay? So the safest one to use for a diabetic person is use the electronic shaver. Okay? Now, or electric shaver. So now I'm going to proceed. I have to make sure that the shaver that I'm using is clean and hygienic. Okay. Now I have to soak this to the water a little bit hotter. Okay, I have to soak this a little bit hotter or warmer, and then I have to a little bit drain it, and then I have to put it in the, okay, I have to put it, soak the skin so to soften the mustache. Okay. Now this is around 30 seconds to 1 minute just to soften. Okay. And also this one. Sorry, excuse me, I just have to soften this. 30 seconds to 1 minute. Okay, now it's already softened. So I have to put before I forget, I need also some and aside from that, I need also a small towel so that I can cover it here on his chest. So I have to put a cover on your chest. Okay. Now I have to proceed. I have to put some water. Do not rub the skin of the patient. Just put some water and some shaving cream. Okay, now you can start from this, the farther side. Okay, from here, you can bring down the side rail and start. Sir, can you please, okay, I have to move your face a little bit here. Okay, just start from here, going down, and then clean. Then start from here, going down, clean. Okay, and then from here, going down, clean. And then from here, going down, clean. Okay, and then from here, here, and then clean. Now, going down to the neck, you have here, you have to down, clean. And then from here, down, clean. Again, down, clean, and down, clean. Now you can use your face towel. Okay. Now if you see there's still some that are left, then you have to slowly do it again until it's even. You have also to make sure that the skin, because there are some instances that you're going to do it this way. It depends on the direction of the mustache. So you have to feel first which way it should be directed. Okay, now I am done, totally done. So I have to dry pat, or pat dry rather. Okay, pat dry. Okay, sir, you look very good. Okay, you look so good now that you have shaved your face, okay, the mustache. So now, so how do you feel? Would you like me to put some cream? Okay. Okay, sir. So I have to put some cream. It's not a shaving cream, but it's a conditioning cream for the skin. Okay, to make you feel good. Okay. Now I'm done. Sir, we're done. Okay. How do you feel now? Okay. Thank you. So I just have to remove this and throw it on the bin. Now I'm done with the shaving. I can proceed to the oral care, which is toothbrushing. Now this time, I have to make sure that my patient is safe before I'm going to leave his place and take again all the materials that I need. So I have to pull this out. Sir, I just have to change all the materials. So we can proceed to your oral care of having a toothbrush, okay? And throw. Hand hygiene. Always show that to your patient so that you will be able to win the trust of your patient. Okay. Have to change. Now I'm done changing my gloves. I can proceed now to oral care. Okay. Now this time, my patient is able, okay, which means he is capable of doing it by himself. So I just have to assist the patient. So we're going to have some oral care, okay? You're going to have your brush to brush your teeth, but can you do it yourself? I just have to assist you, okay? Okay, sir. So, wait for a while, sir. I just have to put some toothpaste. Okay, sir, can you please would you like to gargle first before you're going to brush your teeth? Okay. So, okay, can you please hold? Okay, and he will do it himself. Sir, please. Okay. And then, now sir, can you please brush your teeth? Okay. Okay, sir, can you do it? And then you can do it. Now, this time, the patient is not able. Okay. Now, since the patient is not able, then I have to do it myself. Okay, sir, I have to put some towel again. Okay, sir, we're going to brush your teeth. Okay. with first girdle. Okay. Please. Okay. Now I have to put some toothpaste. Okay, sir. Can you please open your mouth and start from the 45 degrees. 45 degrees. You bring this down to make it easier for you. And then circular motion. And clean. Circular motion. Okay, now, sir, please. Gurgle. Through. Okay. And do everything. Then gurgle. Then through. Now, I have to wipe this mouth. Okay. You can also check if the patient has some abnormalities in his mouth. Okay, like if there are some decays or there are some abnormalities, then you have to report it immediately. And if you smell something from his mouth, then you have to report that also. Okay, so you have to make use of your ability or your skills on physical assessment, especially for the mouth. Okay, so everything is normal. Now, what if your patient is not capable, or like we say, he is suffering or comatose patient? What if he is a comatose patient? Still, you're going to maintain the oral hygiene, but in a different way, because you need to have some suction machine, okay? And then you have to use this one also, okay, to clean the mouth. It's the same. You just have to open this, but you need to, okay, you need to have the patient's face on the side, okay, and then you can use this one. So you can open it and also do the brushing, or you can use your tongue depressor and put a gauze here. And then you can actually have this one open and then do the brushing, the same procedure. Okay, now without the toothpaste. Without the toothpaste. Okay, now you have to put some water and then do the suctioning, and that's a separate procedure, the specialized procedure. For oral care for a person with special needs or comatose person, you have to have another procedure which is separate from here. Okay. So we are done with the oral care. You have to throw this again to your, okay, to the bean in there. Clean up everything. Sir, I have to get back to you for the next thing that we're going to do, okay? Your shampooing and shaving. So now we're going to proceed to your bathing, okay? So we will now do the bathing. I have to prepare all the materials, so please excuse me, okay? Okay, for the shaving, you have to actually try to extend the skin of the patient, okay? Extend the patient's skin so that you'll be able to pull, okay, the inner those mustache or these the mustache to surface, okay, to make it surface. So you have to pull it from here down, okay, and then pull it down. Now, what is the stroke? It depends on the type of the skin of the person, because there are some people that the direction of the skin's mustache is downward or upward. So you have to feel. Okay, usually it's downward, but there are some that cannot be done downward, so you have to actually do it also by upward. It depends on the type of the skin of the person. Okay, but all you have to do is pull the skin so it will surface the mustache. Okay. Okay, now, if the patient has dentures, then you have to remove the denture, okay, and put it in a kidney basin with the water, soak it, okay, and then after that you can also do washing or cleaning the denture, okay. So all you have to do is clean the denture with the toothpaste and brush the denture and then rinse. Okay, now, and then you can actually do the oral care without the denture. Okay, so you proceed with the oral care. Please, if you are going to check also the tongue, if there are some abnormalities with the tongue, okay, not only the teeth or the gums, but also the tongue. Okay, so now we're done. How are you going to keep the denture clean? Okay, there is what we call an oral substance, or what we call the oral mixture for the dentures, which will help the denture to be preserved, okay, and to make it hygienic also. So you can use that one. Okay, so now I'm done with the oral procedure or oral care procedure. Okay, now I'm going to proceed to the complete bed bath. Okay, now complete bed bath is actually performed for the reason that you have to maintain hygiene to your patient. Aside from that, to make your patient feel comfortable, and of course to increase or to have his self-esteem increased. Okay, because a person who can feel better, he can feel better when there is bathing. Okay, he will feel good, and that feeling of goodness is actually helping him to for his self-esteem, to boost the self-esteem. Okay, so now I'm going to proceed to the complete bed bath. Now, what are the materials that I need to bring? Okay, sir, we're going to have your complete bed bath. Okay, so we're going to have bathing from your head up to your feet. Okay, front and the back. Okay, so now I would like to prepare my materials first. Okay, allow me. Now I have to prepare the materials. I have already changed my gloves. I cannot use the gloves which I use for the shaving or for the oral care. I have to change it. I have to do the hand rubbing also. So now I am prepared. I have to prepare all the materials. Now these are the materials that I need. One, I need to have 2 basins, one with the soap and one with the plain water for the rinsing. I have to use 2 pieces of small towels, the face towels, so I can use this one for the soap and for the rinsing. Okay. I need also a bed protector or a towel. Okay. And another towel for dry tapping or dry patting rather. And then I need also a blanket, to cover and maintain the privacy of the patient. I need also some soap. I can use either liquid soap or I can use a bar soap, the solid one. So now I'm going to bring this one, and also need a small basin for the soaking of his hands for the hand care and for the foot care. Okay. First, I have to consider the safety of the patient because I'm going to use some water. So I have to make sure that there are no electrical currents that are actually touching on the bed that might hurt or that might injure our patient. So now I have to bring all the materials to the table. First is I have to make sure that the table is clean. So I have to clean it up. Okay, make sure that it's clean. And now I have to bring this the blankets and the towels. And I have to bring first the one that I need, which is the basin with the water. Okay. Before I'm going to start with the face, I have to make sure that I will put small towel on his chest, which I can use also for drying or top drying later on. Okay, now I have to start from the eyes. I will not use, or soap should not be used when you're going to have to clean the eyes. So you start from the farther side, from inner to outer. Use the one side and then the other side from inner to outer. Okay, and then I can reverse this one. And then, if it's still dirty, then I have to have another wipe it out, inner to outer, wipe it out, inner to outer. After that, again, do not use soap. So now, I'm going to have, remember that I have water without soap and water with soap. Okay, so now, I'll start for the forehead. This one with the soap for the forehead. Sir, this one has a little bit of soap. I just have to wipe your forehead. Okay. Going further. And on this side. Okay. Again. On the other side. Further. Nearer. Then, without the soap, rinse this. Further, nearer. Other side. Further, nearer. So it's clean. Okay. Now, next is the face. So I can actually top this one. Next is the face. Okay, you can actually use letter C. Okay, from here. Okay, from here and then here. Okay, and then the other side. From here to the cheeks. Okay. And then rinse without the soap. Here, face, okay. Sorry, we have to start from the farther side. Here, and then the other side. Here, and then. You can top it dry. And then, start again. While you are doing that, you have to keep on observing if there are some abnormalities in the face of your patient. Now I have to, from the cheeks down to the chin. Okay, again, from the farther to the nearer. So you have here. Other side. Chin. Okay. This one is with the soap. Okay. Chin here and here. Oh, sorry. From the farther here and then nearer. And then top dry. You can check the nose. If the nose is a little bit dirty, you can use the cotton buds. And then from here, from here, further to the mirror. Then rinse. Further. Nearer. Okay. Then start with the neck. from this side, going down here, then reverse. This one is with the soap from the center going here. This one without the soap. Make sure that you have drained the towel. Okay, so from center to the side. Okay. So now you can dry. Never let the moisture or the water to dry on the skin of your patient, because it might attract also some other bacteria. Okay, so you have to keep it dry. Then after that, you're going to have the ears. Okay, so from the ears, you have from the inner to the outer. Okay, inner and then outer, including the back. Inner, outer, the back of the ears. While you are doing that, you have also to check if the ears have no abnormalities, and then rinse with no soap from inner to outer. Reverse from inner to outer. Then try. Okay. So you're done with the face. Okay, now done with the face, we have to go down to the other parts of the body. Now, since you are going to wash or to bath the whole body now, you have to remove the, okay, you have to keep this first away. And then you have to remove the gown. Okay, how are you going to remove the gown? Make sure that the patient, if the patient has an IV, okay, you have to remove first the stronger side before the weak side. So this time, your patient has an IV insertion on the other side, on the right side. So you have to remove first the left side. Okay. Now, this time, you can remove the blanket. Just remove the blanket. Remove the blanket. Do not throw the blanket to the bin, because you can still use that if it is not dirty or it's not soiled. Okay? So you have this one. Leave it on. So now what is remaining here is, okay, now, sir, would you like me to, okay, is it okay with you if I'm going to put you a little bit of your, your head to be a little bit lower? Okay. So make sure that it's not too high. Okay, so is that enough with you? Okay, so it's not for him. And then, have to work it out. Sir, I have to remove your gowns. Okay, but you have to start from this side. If he can do it, you just have to assist. Okay, you just have to assist. But this time, he cannot do it. Okay, the purpose here is for you to be able to develop the skills of feeling or caring for the patient with, okay, who is unconscious or with special needs. So now I have to start, sir. I just need to remove this one. Okay, first is you have to remove or to untie the back. So this time, you cannot do it by changing it on the, or repositioning him on that side because of the IV. So I have to transfer to the other side. So, sir, I have to, okay, Again, follow the ergonomics, the proper positioning. Okay. 1, 2, 3. Now I have to untie this one, sir, so I can remove your gown. As what I have said, I cannot start from that side because he has an IV. And I have now, sir, excuse me, a little bit. Now I can remove this. Make sure that you have to retain the privacy. Now this is good if the patient's bed has an open side. This is the purpose why the patient should not be put on the wall. Now I can remove this without exposing the body of the patient. Okay. Now there are some hospitals that you can actually remove the connector. You can actually do that with some hospitals, but there are some hospitals that are not doing that. It depends on the policy, so you really have to do it this way. But if they would say that, okay, you can remove actually the connector and do the changes, that could be better. Okay, you can start anywhere. Okay, so you have to remove this. Now you have to avoid putting this down, because what will happen, it will backflow the blood. So you have to remain this one, and then so you now then roll it and put it in the bin. Okay. So now we can start from the you can work actually to avoid having an accident with the side with an IV. You can start on the stronger side. Okay, now the patient is ready for the batting of the body. So I have to put now a bath blanket, enough to cover the body of the patient. Okay. The question is, am I going to remove the top sheet? Okay. Since you have already this, then you can actually remove now the top sheet. So you can ask the patient, sir, can you hold the blanket? Okay. If the patient is not able to hold the blanket, slowly by slowly, you can actually drop your top sheet down. Okay. Without exposing the body of your patient. So now, I was able to remove this and put it in the bin. Okay. This time I have to put another towel that I can use to pat dry the patient and also to protect him from coldness. I can use a smaller towel, okay, instead of a bed protector. Okay, but if I'm going to use the bed protector, I still have to use the towel for top drying. Okay, so this one I have to use the. Okay, so I have to start from. Okay, I have to start from the arms. So I have to put something here from the farther side. Okay, you have to lower it down and put this one on this side. To be careful not to hurt the patient because he has an IV needle on this side. The bed protector here is to avoid some spills of water. So now I have to start from the arms. Okay. The question is, where am I going to start? Okay. Do I have to start from the hands or from the shoulder? Okay. If the person, okay, if the patient is or has no or is not a CVA or cerebrovascular accident patient or has no stroke, then I can use the concept of from the cleanest to the dirtiest. On the part of the arms, the dirtiest is the hands. Okay? The cleanest is from the shoulder down to the hands, which is the dirtiest. So, I assume that, okay, from the record, that the patient is not a CVA patient. So I can, okay, this is from the proximal to the distal. Proximal to distal. Okay, so I can actually have this one use. Okay, one side. And then the other side here. If the patient is a CVA patient, remember that there is an importance of therapeutic care. What is the most important there is to help the patient recover by knowing that the blood flow is from here, from the distal to the proximal. So if the patient is a stroke or CVA patient, I have to start from the hands and going to the proximal. Distal to proximal. Okay? It will not follow the dirtiest to the cleanest, or from the cleanest to the dirtiest, but it will follow the concept of the flow of the blood. So you have to do it from the distal to the proximal. If the patient is non-CVA patient, then I can start from the proximal to the distal. Okay? So now, I have to wash this with the soap again, because I used already the two sides. And then I have to use this, the side, okay, from here to here, okay, and here to here, like that. And then rinse with the one without the soap. Okay. Okay. 1, 2. Reverse. Side 3 and 4. Okay. Now you can use another towel for the pat dry. Okay. One good thing, if I'm going to use, instead of using the bed protector, I'm going to use the bath towel, is for me to be able to use this immediately as a pat dry. Okay, instead of using a bed protector, I use the towel. Okay, but this time I use the bed protector, so I have to use another towel. Now I am done here for the arms. Then I have to proceed with the right hand care. So I have to soak. The hands. Okay, while soaking the hands, I can proceed with the other arm. Okay, soaking it. So I have to cover this one. Expose only the part that is needed to be cared. So here, I have to start with. Okay. Before I forget, okay.
Ginamit namin sa video.
Post lang, please.
Go.
Okay, I'm done with all the sides of the arms. Okay, then I can wipe the axilla or the underarm. Going down. It's like this and going down. It's like this and going down. Okay, and then rinse. With water without soap. Again, down and down. Okay, so I have to dry. Okay. Okay, so now I have to proceed with soaking of the hands. Hand care, soak the hands. While soaking the hands, cover the part that is not, okay, it should not be exposed, only the side that is needed to be cared. So now on here on the other arms. Same with the farther side, I have to do it this way also. Okay, proximal to distal, proximal to distal. Reverse this one. We have the inverted one, and then this side and this side. Okay. Then rinse with water without the soap. This one. This one. This one and this one. And then I have to go to the armpit. In the armpit. Here, down. Then here and down. See? Here and down. Now I have to rinse with the water without the soap. Okay, so here and down, and then here and down. Okay. So I'm done. I have to top dry. Okay. And then I'm done with the on this side for soaking. So I have to take this out. And I have to do the cleaning here. It's soft already. So I have to do it from the nails, and then the spaces between the fingers, Okay, the palm, have to make sure it's very clean. Okay, and then rinse with water without the soap. Okay, nails, the spaces. Okay, and then this one. Okay. Make sure that you are not leaning on the patient. So I'm done with that. Okay. And I have to remove this. And then I'll try. Okay. Okay, since this is already dirty, then I have to replace this because the hand is dirty, so I have to replace this. Okay, and then I have to bring again another water and soak this. Wait for 5 minutes. I'm done. Then I have to proceed now. Okay, we have here hands, nails, the spaces between the spaces. Okay. Rinse with this one. You have to make it very clean, spaces. Okay. I have to remove this. Bring this down. And put up the try. So I'm done with the arms. Now I'm going to proceed to the chest. Okay? I have to proceed to the chest. Now, sir, we're going to clean up the chest. Okay? So I have to lower this down and retain the other towel. Okay. Then use the one with the soap. Okay. Now, just for a demonstration, I have to show you how to clean from here and there up to the torso. Okay, and then reverse. So again, you have to start from the farther and then reverse. Start from the farther and then reverse, nearer and nearer. Okay, that is how you're going to. But you have to make sure that the patient is well covered without exposing the. So what you can do is like this. Okay, you have one from the farther, it should be covered, and two. Okay, and then reverse. Then 1 and 2. Rinse. 1. The privacy. 1, 2. Reverse. This is already rinsing. Okay. Now 1 and 2. Now I can use this one for top dry. Again, and then I'm going to cover it. Okay. Now I'm done with the chest, I'm done with the arms, I'm done with the hands. So I have to go down to the feet. Okay. Now, because I used this, all of this already for the feet, and I have to change all of this, throw the water. Okay. Wash all of this. Huh?
Ego.
Okay. So now I'm going to proceed to the feet. I changed already the water. Change the water when you go to the feet. Change everything. Then I can now start from the feet. I just have to expose one side. So I start with, okay. I have to take this one and throw this one. See, I have to expose the farther side. Okay. I can lower it down to the patient. Okay. In a working level. Now I find it already difficult for me to bend, so I have to increase also the height of the bed. For easy reach. Okay, so now I feel comfortable. So I can actually put a bed protector here or a towel. Okay, so I have to prepare for the towel for the top drying. Now I have to start. Okay, so from here down. Okay, and then up. Okay, and twist. Okay, and then wash this, and then the other side. Up to this point only, because this one is really dirty. So from here, and then here. Okay. And then use this, rinse, water without soap, here, then here, then reverse, here, from here. Done. Top dry. While you are doing that, you have also to observe the color of the skin of the patient. Now I have to soak his foot here. Okay. While doing that, I have to cover this, and then I can start with the other side. Okay. Put another bed protector here, so I can work while waiting for that to be soaked. I can work for this. Okay, so I can start from here, upper, down, up to this one here only. On the other side, this, and then reverse from this side to this side. Okay, and then I have to mix with water without the soap. And from here down, and then here down. Okay, and then reverse from here and then here. So now I'm done. to top dry. And then I have to use this one here, and then this one. Nails, the inner, the spaces. Okay. And then rinse. Okay. You have to make sure that it's clean. Okay. Now, top dry. I have to rinse this. And start with this one. Okay. Spaces, spaces, nails, 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 this one, and then use the rinsing. I cannot use the mitten because I have to make sure that everything is inserted. Okay. And I have to remove this. And so I'm done with the other foot, the other leg. Then I have to remove this and this. So, okay, now I'm done with the legs. I'll proceed with the perineal care. Okay, so now I'm going to do the perineal care. First is I have to clean up everything. Okay. Change the water. Into the perineal care. Close this. Sir, is it okay with you if I'm going to clean up now your penis, your the perineal part? Okay? He said it's okay. So now I have to proceed with the perineal care. You see, well, and bed protector. Another set of water with soap and without soap. With soap and without soap. Okay, now I will start, of course, with the soap also here. I'm going to use the liquid soap. Okay, now so I have to. Okay. I need this as a cover to maintain the privacy of the patient. So now, I have to increase a little bit. Is that okay with you, sir? Okay. Now I have to position the patient. Okay. Since he has already a protector, there's no need for me to put another protector because he has already a protector here. So what I need is to bend his knee. Sir, I just have to bend your knee, okay? Okay. Okay, so I can actually, to retain privacy of the patient, I can put here another towel to cover, and this one will be lowered down. Okay, so I can have this one lowered down. So as to cover the patient's sensitive parts. Okay. So you have to bend the knee and make sure that it's covered. Go. So this is actually the position. You can put a cover. Okay. Now, this is for you to be able to keep the privacy of the patient. Now, for the purpose of exhibiting how you're going to do the perineal care, I'll show you. This is for the female. Okay, this is for the female. Okay. So we have to use this 8 strokes of perineal care. Okay, you have to start here from the side. Okay, from the upper part, and then reverse. You can use this side and also this side. Okay, so you have here from here on the groin part down, and also this one. Okay, then wash, then wash, then we have to have this one here, the flabella majora. Okay, here down, flabella majora. That's 1, 2, 3, 4, 5. Then reverse. Flabella minora. This one open. 6. Then the other one is 7. Wash. Okay, from here, 8 at the middle, down to the ans. Okay, so you have 1, 2, going down, 3, and then 4, then 5, and then 6, and then 7, and then 8, down here.
Hello, sir.
Okay. Again, you have to retain the cover. This is the position. It should be covered. Keep the privacy. So again, only for exhibition purpose and for demonstration purpose, this is how you're going to do the female perineal care. Again, use the 8 strokes. Meet, and then from the abdomen part, 1. Okay, you can use this side, going down from the groin side, 2, downward, and then 3, downward, reverse, wipe the flabella majora down. This is, so you have, this is 6, 6. So you have, this one is 6, and then this one is 7. Then wash thoroughly. This one with the soap, or if there is a what we call a pH regulated wash for the women, and then from here downward up to the anus, that is the 8. So you have 1, 2, 3, 4, 5, 6, 7, and 8 downward. And now you have to rinse. Okay, 1, 2, 3, reverse. Okay, 4, flabella majora. 7, wash. is the rinsing already. And then from here, 8 downward. Okay. Now you can use this one, the purpose, because you are actually covering it. While you are doing that, you have to cover the patient. Make sure that both sides cannot actually be exposed. So you can use this one later on to wipe, to dry. It's like this, top dry. Okay, now you are done with the perineal care. Okay, now this is for the women. Now let's check for the male. Same. You have to keep the privacy of the patient. Okay. Cover. And the position is like this. And then, for exhibition purpose, let me show you how to clean. You don't have to follow the 8. The 8 steps. But you still have to, here, 1, it's like this, then here, and then here. Okay, reverse. Then you can actually start from here. From here, down. Okay, so it's here, then here. This one here, it should be round. Okay, clean. And then it should be like here, downward, and here. You see here, from here, downward here. Okay. So now we're going to rinse. Rinse. So we have here, 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 reverse. This is rinsing already. Okay, and this one here. Okay, and then here, down to the anus. So we're done. We have to, so it's the position, it's still like this one. Do not expose the patient's private part. You have to do it like this. Okay? Doing like this way. Okay? Now, I'm done. So I can actually use this one for tapping. Then over again. So I'm done with the perineal care. Now, I'm going to throw all of this. Okay, and then I'll be doing the back side. Okay, so throw. I have to change my gloves because I need the perineal care. Hand job again. Wear another gloves. Please don't forget to raise the always raise the side rail up to avoid accident from the patient. Make sure that the big out is covered. Okay. Now I cannot use this side because if I'm going to turn him to the right side, he has an IV insertion, so it will not be good for him. So I have to transfer to the other side. So now I'm done with the front side. I can proceed to the next one, which is the back side. So I have to change my position from there to here because I cannot turn him to the left or to the right side of him because of his IV. So I have to change. Now, sir, I need you to help me out. Okay? But since you are, I have to make sure that his bed is on the supine. Okay, because I'm going to turn him to the other side. Okay. Sir, I have to turn you to your left side. Okay, so I can clean up your or wash your back side. Okay, sir? So you have to make sure that your body is, his body is still. You have to keep the privacy of the patient. Proper positioning, bend this one. Okay. Sir, at the count of 3, I have to turn you to the other side. Okay. 1, 2, 3. We have to maintain or keep the privacy of the patient. So is it okay with you? You can move this one. Okay. Okay. So now I can proceed. So I have to start from the upper side of his back. Remember to keep the body, okay, keep the privacy of, or never expose the body of the patient covered. And then you can start from this downward, just to show you for the purpose. Downward. And here. Reverse. From here. Here. Okay, then you have to rinse. This is just for the purpose I have to show you, but it has to be covered well. From here, reverse, only just use one side and then another one in reverse. Here and here. Okay, now so that is. Actually, you're going to do that, this one like this, and this one, and this one. Okay, so still covered. I'm done with that. Okay, I have to top dry. Okay. Now, to the back side. You have to okay, I'm done with that because of the perineal care. Okay, now I have to do some back tapping. Then rubbing, fluorage. Okay, so sir, how do you feel now? Okay, so it's done. Now, I have to put him back to supine position, maintaining the privacy of the patient. Okay. Now I'm done with my bed bath. So now that I'm done with my bed bath, I have to change the linen first before changing the gown. Okay, so I have to. Okay, now I'm done with my complete bed bath. So I proceed to the changing of the bed linens before I'm going to change the dress. Okay, so I have to make sure that everything is clean before I have to change his dress. So this time I have to change the bed linen, still covering him. I have to prepare all the materials for the changing of the bed linen. Okay. Okay, so I'm done now with the complete bed bath. So I'm going to perform the changing of the linen or the bed making with occupant or with patient. We call it as the occupied bed making. Okay. So what are the materials that I need? First is I need to have the bottom sheet. Okay, and then I need to have also my protector, bed protector. I also have the draw sheet. I need also the top sheet. I need also the dress for the patient. And I need also the blanket and the pillowcase. Okay, so I need to. Now, if I'm going to take this from the stock room, I need to bring this one without touching my body. Okay, and then I have to put it in a clean surface. Okay, clean surface. And then so I have to sanitize the surface. Since we sanitized this already a while ago, then I'm not going to do that anymore. Okay, so now I have to start. Again, keep the safety of the patient and the privacy of the patient. Now, so first is we have to work it out on removing all the old linens. Loosen everything. Work on one side first. Okay. Work on one side first. Since your patient here, you really have to turn. So I have to remove, loosen everything. The bottom sheet, the draw sheet, I have to loosen it. Okay. Keep your patient on supine position. Now, this is the weaker side, the right side, and this is the strong side. This time I have to start with working with the strong side. Okay, why? Because if I'm going to start working there, I have to reverse him fully. But if I'm going to start from here, I can work out even if I'm just going to move him to that side. Okay, I can move him to that side. Using the draw sheet, okay, I can actually move him to this side. First part, then second part, and then third part. And I can use this one on the feet. Okay. And roll it. Okay. Sir, I just have to change your linen, okay? Keep communicating with your patient while you're doing this. So I hope, okay, you're okay. I just have to change this. We need to change this, okay? so you feel convenient and comfortable for you on your part, and you have to clean it up. Okay? Then check, this is the bottom sheet. Check the bottom sheet. Always check which one should be on the foot side and which one is on the head side. Always remember that the side with the larger hem should be on the top side. Okay? The larger hem, it should be here on the top side. And also, for the bottom sheet, the level should always be on the edge of the foot. Okay? Always on the edge of the foot. While this one is overlapping here, like this. Now, this is the center of your bed. Put this one on the center of your bed. Okay. Put that at the center of the bed and slowly draw this one. Making sure that the wrong side should be at the bottom. As you can see, this is the right side, this is the wrong side. So, the wrong side should be under the, okay, it's facing the bed. Okay, and then spread that one. Spread this one. Working on one side only. Okay. If you can still elevate your, where's the remote? Okay, it's maximum. Okay. Change this. This is on the same level. Should be on the same level for the bottom shape. This one is overhead. Make sure it's not touching the floor. So we have to do the mitering. Okay, so this is how you miter it. Insert this one here. All of it. Okay. Now form a triangle. Pick one point here and make an angle of 45 degrees angle, and then insert this first. Remember the ergonomics, you have to balance yourself. Bend your knees and do not bend your hips. Okay, so therefore there is already a triangle that forms here on the side. Okay, the triangle, and then insert this one. You have to start from the head side down to the foot side. Insert all of this with your knees bent. Okay. Make sure that there will be no wrinkles, because it can cause friction, and that friction to the body can cause pressure ulcer or bed sore. So make sure that it's fitted and no wrinkles. Okay, now I'm going to have the draw sheet. Okay, so this is the middle part of the draw sheet. So you have to make sure that roll this one here and enough space, drop enough space or enough of the edge so you can also insert this under the bed together with the bottom sheet. So roll this. Open it. And roll it here together with the bottom sheet. Roll this together with the bottom sheet. Okay, it should be from, this is the shoulder. This is the shoulder. It should be a few inches away from the shoulder. Okay, to support later on if you're going to move the patient from the butt on this part. Okay, so you have to make sure that it's distributed so that when you're going to move the patient side by side or downward and upward, it will not injure his back. Okay, so let's put it there. Roll. And then now, your bed protector. Roll it also together with the draw sheet and the bottom sheet. Okay, enough only from the edge, but it should be on the back side up to this one, up to here. Okay. So roll it together with the bottom sheet and the draw sheet. Now, I'm ready. You have to tuck this in together with the bottom sheet. Only the draw sheet and the bottom sheet will be tucked in. And close this. I have to change my position on this side. Sir, I have to move you from this side to that side, okay? Turn him to that side. Again, without exposing his body. Now, I have to remove first all of this. This is the old one. Okay, roll this one. Keep it away from your body. Put it in the now roll this. And also the other the draw sheet and also the protector. this in here. Start from the top. Bend your knees, do not bend your hips. When you're doing that, then from here, okay. How to miter this one? Drop. Okay. Now form the 90 degrees triangle. Pick one here. Okay. As you can see, there should be a triangle. Like this. This is the triangle. It should be 45 degrees triangle. And then from here, insert this. So there should be a triangular form here. It's like this. And insert. Together with the draw shape, insert. Make sure no wrinkles. Avoid friction. And fix this one. So there is a triangle on this side. Okay. So now I can ask my patient, sir, I'm going to turn you here. Okay, 1, 2, 3. Now, okay. So I have to maintain the privacy again. Okay. See, I have to adjust make sure that the bed protector is lower. So it's wrinkle free. Now I can proceed to changing his cloth or his gown. Okay. Changing the gown. Pause muna, please. So I'm done with the linens. The last one is the changing of the pillow. Okay, pillowcase rather. Okay, so I have to change the pillowcase before I'm going to have him wear the. Okay, so when you're going to change the pillowcase, keep it away from your body. Okay. And reverse this when you're going to change it. Reverse. And then put it in the Now how are you going to have the pillowcase? Okay. Okay, away from your body. Okay. Okay, pause mo na. You just have to put this one here. Okay? Do not try to. Okay, that you have to. You are not supposed to do that. Okay, just like this. Okay, and then, sir, excuse me. Okay. Yes. Just. So it's complete. Now I'm going to proceed to the changing of the gown. Okay. Now, changing of the gown, you have to know where is the weaker side. You have to start from there. So then, since that is the weaker side, I have to start doing it from here. Ayoko nito, sorry. Okay, so now I'm going to start from the weaker side. Okay. You can ask your patient if he is able, but if not, you have to do it yourself. Assuming that he is not able, you have to do this one. Post, balik yung second ko. Dito ko nalagay sa ano. Dito ko nalagay ang ano. Dito nalagay. This one. Okay.
Ay, pwede na?
Okay, so I have to start. Remember that I have to place the back side. Okay, this is the back side. So I have to start from here, from the weaker side of the patient. Okay, so now I can already remove the blankets. So everything is now clean. Okay. So I have, sir, I have to turn you around on that side again so I can close the back. Okay. Okay, so I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. So I have to turn you around on that side. Okay. Usually this gun is not being used for a bedridden person because it will actually cause friction. Okay? Okay, then. There you are. Sir, excuse me. Okay. So now, the last one is the top sheet. So, opposite with the bottom sheet, the top sheet should be still the larger hem is on the head side. Okay, but this one is just up to the edge, and this one is over the bed. Okay. Let's put the center again here. This is the center. Sir, okay, you just have to put your spreadsheet. Okay. You can fix that one later. Okay. And then your blanket. Okay. As you can see, your top linen or the top sheet, the right side should be the one touching the body of your patient. The wrong side should be away from the body of your patient so that it will not cause the friction. Okay, so this is the wrong side, this is the right side. So the wrong side is over, under that is the right side. So you have to hold it. And same with this one. Okay, the right side should be under and the wrong side should be on top. Same with the top sheet, it should be on the bedside level, I mean the edge of the bed. While this one is on, that depends on the length, but it should be on the same, almost the same level of the foot side. Okay, so this time, okay. Fix it with your then together with the top. Tuck it in. Okay. So, since this one is already tucked in, you have to pull a little bit to give space or enough breathing space for the feet. Okay? And then you can actually put this one here. And also tuck this one here. Again, follow the monitoring. Ilang degrees? We have 45 degrees. Now, okay. So now you have to use the also WD. You have to align the patient, make sure that his body is aligned. Then ask, sir, do you want the light to be open or you want it to switch off? Okay. S, safety. O, open the curtain. Don't forget to return this for safety. Okay. Sir, do you need anything? If in case you need something, you can actually have your call bell, put it on the side, or you can put it on the nearby, but reachable for him, wherein he can use the stronger side and not the weaker side. So put the call bell here on the side, and then ask him, sir, if you need something, anything, please just call us with the call bell. Okay? Now, so you have here, I'm done. Sir, thank you very much. Okay, just take care. And I'll see you later on. Okay? So, next is, clean up everything. Remove everything inside the room. Okay, so this time we're going to have the bed making for an unoccupied bed. Meaning, nobody is occupying the bed and we're going to prepare it for a patient who is coming in. Okay? So the things that we are going to prepare, the materials are, one is we have the bottom sheet, then we have the draw sheet, we have the bed protector, we have the top sheet, the blanket, and the pillowcase. Okay. So when you're going to carry this from, or take this from the storage room or the stock room, you have to make it reverse and make sure that everything is clean. Now before you're going to proceed taking all these materials, make sure that you have your hand hygiene. Okay? So do the hand hygiene. And wear the gloves. And carry this. Bring this to the table, but make sure that the table is clean so you can actually have it wiped. Okay, and put it here. And now we will start with the bottom sheet. So this is the bottom sheet. Since this is the headboard, then we have to make sure that the larger size of the hem should be on the headboard side. Okay? Should be on the headboard side. Put this one. Okay. Now, level the bottom sheet to the edge of the bed on the foot side. And make sure that the center of the sheet is at the center also of the bed. Now, we're going to open. Work on one side only. Now,
Go.
okay, so again, we're going to have the larger hem on the edge of the bed will have the same level with the edge of the bottom sheet. So make sure that this bottom sheet, the wrong side should be under and the right side should be on the top. So this is correct. Now you are going to have this one spread. So now you're going to have the bottom sheet will have the right side on top and underneath is the wrong side. Okay. Now, we're going to tuck in the head side first. And okay, after tucking in, you have to miter the corner of the headboard side. So you have to form a 45 degrees and then tuck in this one. Okay, and then this one. Make sure that there are no wrinkles. Work on on this side first. Now you can put also your draw sheet. Okay. Unfold this together with the bottom sheet, put it under the bottom sheet. So make sure that this is on the level of a little bit below the shoulder. Okay. Then your bed protector. Now it should be lower, that covers the butt and the lower back up to the butt side. And then insert this also at the bottom of together with your draw sheet and bottom sheet. Okay. Make sure that there are no wrinkles. And this time, you're going to tuck in together with the bottom sheet, your draw sheet. Okay. Make sure there are no wrinkles. Okay. Now we will work on the other side. Tuck in the headboard side. Okay. For miter. Okay, so you have to form a triangle. 90 degrees. Insert tuck in this. Drop this one. So there is a triangle. Insert this. And work with the lower part. Now, drop your draw sheet, tuck in together with the bottom sheet. Make sure that there are no wrinkles. Now, your okay. So you're done with your bottom sheet, your draw sheet, and also your bed protector. Now we will work on the top sheet. The top sheet wherein the wrong side should be on top. So we have this one here. Make sure that it's in the center. Again, you have to have your bigger edge or hem should be on the headboard side, and then it should be level on the same level with the bed, while your bottom sheet, the edge, okay, it should be over the bed for the lower side. Okay. Let's reverse this. Okay. Now we have to open it so that we can see the wrong side is on top, the right side is at the bottom. Now this is to avoid friction to the body of the patient, because the edge where you can see the wrong side or the sewing, this can cause friction to the body and may develop into pressure ulcer. Okay, so I have to spread this, all of this. Now do not tuck in yet. Just drop this on the sides. Make sure that there are no wrinkles. Again, the edge of the linen should be the same with the edge of the bed for the headboard side. Okay. Now, we will have a bed blanket. The bed blanket same as the top sheet, wherein the wrong side should be on the top, and this one also is the same level with okay. Make sure that if there is a shortage, then you have to make sure that it has a higher, or the lower side is longer than the head side. The foot side should be longer. Now this time, okay. This time we're going to tuck in both the bottom sheet and the blanket. If this is the door, the entrance of the patient, then this has to be open. If this is the wall, this one is closed. Okay? So you have to tuck this in. You have to form again mitering together with the blanket. Insert, tuck in. Then you have to have this one open. It depends also on the policy of the hospital. Usually, this one is left open. You can actually have this one. Depends on the policy of the hospital. Usually, this is being so you have to leave that one open. Now you have to put your pillow again. When you're going to dress the pillow, dress it against or away from your body. You can fix it here on the bed. If you close this one, you can open this one. It depends on the policy of the hospital. Sometimes they just let this also have open until the, okay, that's why we call it as unoccupied bed. This is in preparation, should be away from the door. Since it is there, it can be on this side or on this side. But if the opening of the door is there, then you have to reverse this from here.
Okay.
Okay, the opening or entrance is here, so you can put it anywhere. Okay,
Yes.
because it's on the foot side. But if the door is here, you have to position it away from the door.
Okay.
Excuse me, sir.
Ba't siya nagpaiwan?
Go.
Okay, so now we have to fold together with the blanket. You can fold also the top sheet. retaining this one. Only the top shape. Insert this one here, but let the other side to be open. Okay. Make sure there are no wrinkles. Okay. Now, you have to work up with your pillow. Okay. And okay. And you're done. Okay. So this is now the unoccupied bed and an occupied bed. A bed without occupant or no patient.